Welcome to episode 4 of the Revive and Thrive podcast, Actionable Steps for Physician Dads to Combat Burnout. I'm your host, Joshua Blum, and today we're going to be talking about the letter D. We're going to be approaching it from a couple of different standpoints, but D stands for deficit. One other thing, D also stands for dad, which is obvious, right? When I was creating the theme music for the little intro and outro, it is actually in the key of D major. That was actually not intentional, but I picked it, and it's this one. When I was doing it, I wanted to create something where there are steps. It kind of feels like it's going up a ladder. I guess it signifies that there are steps, a progression to doing things, and that all you really need to do is start at the beginning and then do the next step and the next step and the next step after that. And so in that fashion, that's kind of what we're doing with this podcast. We're starting with things that are small and we're trying to build on them slowly. And so when you do that, it becomes actually much more manageable than starting with something big and then trying to just sort of grab your nuts and go. I did, when I was in high school, I did gymnastics. I was not somebody who did that at an early age. I had some friends I had done martial arts and stuff like that. They said well, why don't you give this a try? And I'd never done that before. If you're going to actually learn things properly for gymnastics, you learn things in a progression. You start with something that's relatively manageable. Say let's take a forward roll. And then you learn the next thing after that. Maybe it's a handstand. And then before you know it, you progress slowly up to something like a handspring, where if you had just started with the handspring or front flip or whatever it is, it would have been much, much harder to just sort of we used to call it kamikazing. It just sort of you go for it where you have no clue how to do it. You just kind of throw your body into it, which is how you get hurt. But if you do it in progression, you're probably less likely to get hurt. So it's kind of the same idea. So anyway, it's a stepwise thing, and that's why the theme music is the way it is. So deficits, let's just talk about that. Why did I pick that for D? One of the things that happens a lot when people are burning out is that they're burning the candle not only at both ends, but they're burning the candle in such a way because they're lacking something and they're trying to make up for it with hard work or just doing the same things over and over again. We all have areas that we can't know everything, right? This is one of those things, I'm going to just say it because it's one of those things that people start to get very defensive on, and you may start to find yourself getting defensive about it as well. We all learn the same basics, hopefully, in medical school, right? We have to pass certain board exams and stuff like that. But yet, the more things you learn, the more questions you generate. So you can't know everything. So we often will get to a point where we reach the limits of what we know. However, if we encounter patients or situations in our work beyond what we have learned, but yet we're trying to operate at that edge of the periphery of our knowledge base, we're going to constantly be stretching, constantly be trying to make up for the fact that there's something that we don't entirely understand, there's something we don't know, and that's going to be frustrating. But if you can identify that there's a deficit in what you know, and you're able to admit that to yourself. And that's a big thing, I would say. It's remarkably liberating in a way to be able to say, I don't know, I don't understand this, to patients and to your colleagues. Not necessarily something that all people feel comfortable doing. I will say for myself, it's something that I found that as I have gotten older, I've found it easier and easier to do. One, because I care less, but also two, because as we become more secure in what we do know, we become more aware of what we don't know. If you look at a medical student or say an intern or whatever, it's going to be a lot harder for them to kind of say, I don't know, and be truly honest and sincere about it than someone who's been practicing for 20 or 30 years. And it's relatively secure in what they know. Not as a generalization, it's not true of everybody. If you've ever been to an M&M, encountered this, you can see how tense it can get. Or, you may even encounter this yourself. You're presenting a case at a conference. Maybe it's a morning report. It doesn't have to be anything super formal. And people start to ask you questions. And well, what about this? Did you think about this? And you may start to find yourself getting defensive. It's I didn't think about that. Oh, maybe I should have done that. That's the whole point of those things, is to generate more ideas. But sometimes we find ourselves getting defensive because maybe we didn't do something right. And if you think about the consequences for when we mess up something, or even if there's at risk of screwing something up, there's very real, often legal ramifications for that, or maybe from administration, your higher ups or whatever. So that said, being able to admit like, okay, I don't really know the answer to this, or this is something that I don't necessarily know how to do, is not always the easiest thing. If you're still happen to be listening to this and you're still in residency, capitalize on that, absolutely, because there's tons of people around that can help you with that. Even though that's an area where you're still learning your boundaries of where you are, where your craft is, those people around you, the mentors that you have, hopefully you have some good ones, that's remarkably helpful. And that becomes harder and harder to find the further and further you get from residency. Having good mentorship is enormously helpful in this area, because you want someone you can bounce ideas off of. You want someone who's going to be able to tell you like, hey, look at this, do this, and not in a judgmental way. Some people who will actually pay for supervision of some kind so they can actually get that, because they can't necessarily get it from their colleagues. If you're in a position of leadership, it may be also quite difficult to ask your colleagues who you may be supervising in other capacities to do that for you. It's a little bit awkward, an imbalance of power. Having good mentorship is really key in that regard. We have certain limits to what our training has. Things that you encounter in your work that you were just never trained in. It's not your fault. Didn't get the training. If we're trained in all the things that we would potentially encounter on a regular basis, especially the more difficult ones, our residencies would probably never end, or they'd be like 10 or 20 years or something like that. I did 4 years of adult psychiatry, and then 2 years of fellowship for child and adolescent. And I feel like it could be at least another couple of years, and I still wouldn't have encountered all the different things that I feel like I've learned since that time. Speaking of which, I'm going to pick on psychiatry and neurology just because I happen to know something about those. But in neurology, I don't know if it's still this way, but at the time when I was in residency, neurology residency, you got 1 month of psychiatry, woefully inadequate to prepare you for the amount of mental health stuff that you'll encounter as your typical outpatient neurologist dealing with things like headaches and epilepsy and things like that. A month is not nearly enough time. Psychiatry, how much neurology do you typically get? At the time, when I was going through residency, I think it was 2 months. Now, we got more in my residency because the program director was also a neurologist. For many folks, it's like 2 months, maybe it's sometimes 3. Woefully inadequate, not nearly enough for the amount of things that you encounter where there's a crossover to the neurological side of things. There's a whole other topic. You could spend a lot of time talking about this. But the same can be true for many, many other specialties. You're just not given everything that you need to know. And so you're going to have to grow. And obviously you can go to conferences and, this is the whole point of all that maintenance of, maintenance of certification bullshit. I mean, it's the whole point of it, right? Is that you're supposed to be continuing to grow. And ultimately, a lot of that stuff ends up being paperwork. But obviously, you're supposed to grow. But how do you have time to do that if you're also spending all this other times documenting and filling out checkboxes and ultimately making a living seeing patients, right? How you have the time to continue to grow. One thing, as I said, we're talking about little things, actionable steps, right? One thing that was actually really helpful for me, this may not work for everybody, but one thing that was really helpful for me is to have a goal. Every time you go into, let's just say clinic or whatever, it's your work day, you pick a goal, something that you want to work on, something that you're not terribly good at, or something a skill that you want to maintain. And you're like, I want to see if I can work on that a little bit. So at some point in the past, I decided that I wanted to work on seeing the fundus in an ophthalmologic exam. The retina is the only part of the brain that we can see. I might as well take a look at it. It's one of those skills that comes in handy every now and then, but it's something I wanted to work on. I was working with a neurologist at the time. I got a lot of opportunities I sought out that because I felt that there was a deficit in my training to address the amount of things that I was encountering, and I was very thankful for that. But that was something that I wanted to work on, and something that I want to maintain. So it's one of those little things that I was like, okay, I'm going to work on that today. It may be something else that you are not very comfortable with doing. Maybe it's a particular skill that you had to do it a couple times for in residency or whatever, to get certified in it or whatever. But it's one of those things that you don't do very often, but you want to look for opportunities to maintain that skill in some way, keep it somewhat fresh. Or if it's something that, let's say, a goal that you have perhaps it's something like mundane, like documentation. You want to try to be more efficient with what you write. You want to be able to, I know one goal that I had, when I first started out using the computer, I was very uncomfortable typing while talking to a patient. Just not something that I learned how to do. Typing actually typing was actually a learned skill. That was like, I'm going to work on trying to be more efficient in that way. And actually, it was a whole progression of doing that. It doesn't have to be a big thing, but I would say whenever you go into a clinic, consider having a particular skill that you're going to be working on, a particular thing that you want to work on, because then you feel like it's not just you giving. It's also you getting something back in return. You're working on a particular part. I would say also seeking out people that can help you for those areas that you're not comfortable with. Let's just say you are somebody who is encountering a certain kind of patient that you're just not comfortable dealing with. You don't have the knowledge. They make you uncomfortable, whatever it is. So one idea would be to find people who have more experience than you and see what they do. You may not necessarily have the ability to shadow them or whatever, but just asking them, hey, what do you do in these situations? And continue to ask, not just once, not just twice. Ask again, until you find something that clicks and makes sense. And then go try it and then see. And then ask again. All right, so that's the whole point of having good mentors. They don't necessarily have to be in person, right? They may be colleagues that you have that, old residency classmates or whatever. You don't necessarily have to see them. You could just send them a message or whatever. But having those people to be able to bounce ideas off is just enormously helpful. You feel less alone, like you're just trying to do it all by yourself. The last thing I'll say, this is an idea that comes from a particular school of therapy. It's called self-psychology. Kohut is the person that's associated with it. This idea of empathic failure. The basic idea of that is that there's a lot of medicine, a lot of whatever, that we can't control. And so sometimes all we can really do is be there when people are not doing well. That's a sort of original thing of what a doctor did is, you're bearing witness to suffering. And this is where the dad part comes in. And you've had kids that walk and are going through that period of time, that they fall. And you can't always be there if when they fall. As much as you would like to prevent them from falling when they're walking, falling down the stairs, falling off the bed, falling off playground equipment, you can't always be there. You try, but you can't always be there. What can you do, really, as a parent? Well, you pick them up, you comfort them, and you check them over, see if there's anything that needs to be done immediately, and hopefully you help them get back on and do whatever they're doing so they can try again. And so when patients fail at something, it's not necessarily anybody's fault. Sometimes it's whatever you're doing, it's just not going to work. It's just not the right time. It's not the right diagnosis. It's not the right treatment, whatever it is. And what you can do is bear witness to it and say hey, we tried this. It didn't work. That sucks. But hey, let's keep moving forward. Let's keep trying. Often we start to internalize that. We feel bad about it. But we kind of take a step back and recognize that, a big part of what we do is not necessarily in our control. And what often people really want in a doctor is they want someone who is there for them, whether they're doing well or not. Actually, if you think about it, if they're doing well, they're probably not going to come to see you. They're good, right? Our current healthcare system is set up that people come to see you when they're not doing well. And they often want someone who is understanding when they are in that place. So empathic failure, when I first encountered that probably as a resident, it felt like it took a little bit of a weight off, because it meant that I wasn't personally responsible for how patients did. They were going to do whatever they're going to do. My job was really to present them the options and help guide them through it. And then if it didn't work, then to guide them on to the next thing. And so obviously having the right skills will help with that. Having the right mentorship will also help with that, because that person or people can help guide you toward the right decision making. But ultimately, the whole diagnostic process is that if something doesn't work, either the underlying diagnosis was not correct or the treatment was not correct or both. And so you do that again and again and again. It's very easy to get stuck. And you guys who have been doing this for years know this process. Those of you who were dealing with burnout, often there is some of this involved, and that's why we're talking about it today. So those are a couple little things to think about and to play around with. A lot of what we're talking about are little things to try, and I would think of it almost like play. Play is the main job of a child. And those of you who have young children like 3 or 4 years old, you know it takes forever to go anywhere because children are constantly exploring their world. Everything is new. So when we look at the world through the eyes of a child, we see possibility all around. So that's the whole point of a lot of these different things, is just to see additional possibilities so we get less stuck. We're less banging our head against the wall. Let's try something a little bit different. So with that said, thank you for listening, and I'll talk to you next time.